Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Lee Hicks, who is an oncologist with Baptist Health. Now, oncologist means cancer, and nobody likes to hear that word, but I will tell you, Dr. Hicks, you take great care of the patients that we send you. They love you. You do a great job. But I really don't like to send my patients to you if we don't have to. But what are some of the cancers that you see, some of the common types?
The most common ones, of course, are lung, breast, colorectal, genitourinary cancers, gynecologic, oncologic problems, but we see everything. Yeah.
And you tailor that treatment to that specific cancer, that specific person.
Yeah, more and more so. The question that we even started with there will be in the future probably relatively moot. We're going to move away from where did the cancer start and go down to the molecular level to say what is its molecular fingerprint and how can we target it based on its molecular Achilles heel. It's a personalized approach to cancer. And I predict into the future as we get more and more into immunotherapeutics, using the person's own immune attack and learning more about the person's own individual malignancy and harnessing therapies that are individualized literally to the individual, it'll become less and less about where did it come from and more about how many targets do we have.
Well, now, when I introduced you, I said oncologist, but you've got a longer title. And that kind of tells a little bit about Baptist Healthcare Center. What is the title?
I'm medical director of medical oncology and infusion services. So I'm everything that's not radiation or surgery. If I come at you with a knife, you need to run.
But you mentioned radiation, surgery, medicine, infusion. Yeah. All of you all work together in terms of treatment of cancer.
Right, and we're a close team, all of us, the surgeons and the radiation oncology doctors, the medical oncologists, we all work together. We also have an incredible team around us, everything from our research staff that we have unique to Kentucky for a hospital system-wide, sponsored by the hospital to cover those trials, nutritionists, genetic counselors that out of our system service our entire state. We have an incredible team of radiation oncologists with up-to-date technologies that are not available in other places, and from gynecologic oncologists and plethora of surgical specialists that work with us. But as we grow towards Hamburg, already being in Lexington proper centrally, having places in Frankfurt and Richmond, I think about this more as a cancer program that takes care of the person in multiple locations. And our program is one, though our locations may be many. But everything is available wherever you see a Baptist cancer doctor.
Now, I mentioned the Hamburg location, and that's the newest location. So tell us a little bit about that. But you also mentioned it's kind of like you can go there, you can go Nicholasville Road, you can go wherever you are.
Yeah, we have a crossing. Brandon Crossing has an infusion center as well. And a lot of this is primarily based at trying to get closer and closer to the patient to make treatment more and more easy to access and closer to their home front. But also, frankly, it's a pragmatic thing. We've been successful in taking care of people, and Bill Sisson, who is the guiding light in the building and founding of Hamburg, and now Chris Rohde taking over from him as president of Baptist Lexington, has helped build this vision. But you know, we as we go forward, we take everything that we do in one location is available wherever they may go, but it's ultimately when you take, Bill always said, if you take good care of people, everything else takes care of itself. And I think what I would take the greatest pride in is we want everyone to feel like their treatment is individualized, and that doesn't just mean technologically, it means interpersonally.
And you mentioned infusion center, and everybody thinks chemotherapy. Briefly, it's really not as bad as it used to be?
No, and by dint of the fact that not everything is chemotherapy, anything that I do that involves a cancer patient is euphemistically called chemotherapy, but technically a lot of the therapies we now give aren't, quote, chemotherapy that attacks the DNA in the middle of the cell. It may have to do more with targets outside of the nucleus in the area we call the cytoplasm that uses what are called tyrosine kinase inhibitors, pill type therapies and things, and it may be immunological therapies. And now we are piloting a project looking at bispecific T-cell directed, very specific immunologic therapies that we are bringing into the community and not just in the academic centers of the world.
Well, we appreciate all you do, and again, just because I just know the care that you give the patient, just from a medical and a personal standpoint, you guys do a great job.
Well, I appreciate it. It's always an honor to be with you, bud.
All right. Thank you for coming in.
Thank you.
We'll be right back.